Hi, everyone, and welcome back to Raising the New Earth podcast, where we explore healing, wholeness, and the emerging consciousness that is shaping our present and our future. I'm your host, Noah Dory, and today we're going to dive into something that might just shift the way you think and see your body and your pain, especially if you've been struggling with chronic back pain, neck pain, or even migraines that just don't seem to go away. Our episode today is titled, Could Your Back Pain Be TMS? Healing Beyond the Physical. So, what if I told you that your back pain or other pain didn't start in your body, but in your brain? Not because it's all in your head, not because it's imaginary, but because your body and your mind are so deeply intertwined that emotions like repressed anger and even rage could be showing up as very real, very physical pain. I was introduced to this concept of TMS after recently experiencing a rotator cuff injury during my jujitsu class, an injury that threw both my nervous and my musculoskeletal system into chaos. I was finding myself being really challenged, both physically and emotionally. And during this recovery that I'm still wrapping up, if I'm being honest, my colleague and amazing psychiatrist, Dr. Daniel Ayman, and his wife, expert in brain health, pointed me toward the groundbreaking work of Dr. John Sarno. His teachings, when I read the first book that I'm going to mention in a second, when I read the book, my pain went away. I'm not kidding. Just I read the book, it resonated with my body and with my heart, it resonated with my brain, and the pain went away. And that is after doing acupuncture twice a week, cupping, as well as attending to my nervous system by taking supplements like B complex, B12 for the central nervous system, um, and magnesium. So his teaching radically shifted how I understand pain, trauma, and the profound connection between mind and body, and strengthened my commitment to integrative medicine even more so. So let's unpack this. And we'll begin with looking at the work of Dr. Sarno, a pioneer in mind body medicine. So, who was Dr. Sarno? Dr. John Sarno was a rehabilitation physician at NYU who specialized in back pain. Over the years, he noticed that there was a curious pattern. Many of his patients, even those with disc bulges or other structural issues, weren't improving with surgery or physical therapy. He started asking himself some really critical questions and started questioning his job in helping those people with back pain because he didn't see progress with his patients. But when he started exploring their emotions, particularly repressed anger and pressure to be perfect, he noticed that the pain with his patients would lessen or even disappear. And that's when he coined the term TMS, Tension Myositis Syndrome, also known as tension syndrome. In plain terms, it is real. The pain is real. It's not in your head. It is a real physical pain caused not by structural damage, but by the brain's response to suppressed emotion, often as really a distraction mechanism, which is what I love about our bodies. Because, even if you look at eczema or rash, or anything like that, this is our body's way of pushing it outside to the surface to protect our internal organs. So I always say our body always speaks to us, but we just need to learn to listen. So Dr. Sarno's work flew in the face of conventional orthopedic and surgical treatment, but his results, nothing short of remarkable. Now, a little disclosure, I'm not saying that anyone should explore the options that are available, but I am trying to bring to surface, like I do in every episode, another point of view, another angle, and really encourage those that do that are set up on doing a back surgery to read his books first, see if it resonates with you. Now let's review. So his most influential books were Healing Back Pain, that I just finished reading. In 1991, he wrote this outline of how TMS works, why MRIs may be misleading, and shares success stories of patients who healed without surgery or drugs just by understanding the mind body connection and going through his specific program. Then the other book is the Mindbody Prescription that I'm finishing up right now. And this book expands on the concept of emotions like rage and guilt and pressure, and how they can cause not only back pain, but also GI issues, headaches, and more. When I worked at the mental health facility, I've noticed a lot of GI issues with patients that were abused emotionally and physically, and that connection was really, that knot was really difficult to undo without attending to the emotional and psychological aspect of their pain. He was the one who introduced the idea that unconscious mind uses pain to distract us from unwanted emotions. Again, just brilliant mechanism of our own bodies. And then there's a most recent book was written in 2006. It's called The Divided Mind. It is a more, it's a deeper, more scholarly dive into psychosomatic medicine. He explores many case studies, psychology, and partnerships with other physicians who have seen similar patterns in their own patients and similar results. So here's the key. Dr. Sarno wasn't saying that the pain isn't real, like I've heard many times when I was, growing up, and I had celiac. I was told by many, many MDs in the ER, oh, it's in her head. So the pain is real, but the cause is different. So instead of herniated disc or inflammation, the root cause in his approach is the brain creating pain as a protective destruction, as a protective mechanism from really powerful, uncomfortable, unattended emotions. So is it psychosomatic? This is where we need to read his work carefully. In mainstream culture, psychosomatic is often misunderstood to mean imaginary or fake, but that's not what's happening here. What we're talking about is a downward causation. So integrative medicine, and I mentioned it in one of my episodes, integrative medicine is all about downward causation. So the symptoms that we see on the surface don't start with our body. This is not body up. This is brain sending a signal, and hence the downward causation all the way down to the symptoms we see on a physical level. So it's a concept that integrative and quantum informed medicine see as the consciousness that affects biology meet. So thoughts, emotions, belief systems, these can cascade down to influence our neurology, our immune system, and even our tissues, which is a crazy concept and pretty amazing to keep exploring. So no, TMS isn't psychosomatic in the dismissive sense. It's a real psychological response to psychological stress in a real pain. So the brain, in an effort to protect us from the emotional overwhelm, diverts your attention to the physical pain. And it does that by limiting oxygen to muscles and nerves, causing very real discomfort. I've been very uncomfortable for the last several months since the injury. And again, I'm sharing this with you because it had opened up my understanding of pain so much so that my pain so far has gone away. So pain science now supports this. Studies do show that chronic pain can persist even after tissue healing driven by neural patterns in the brain. So the people that he has seen the most effect with were those professional perfectionists. And so he explored the perfectionism-anger connection. Anyone else is a perfectionist? Raise your hand if you're seeing me on YouTube. I'm right here. Not as much as I used to, but yes, I'm a recovered type A personality, as I like to call myself. So Dr. Sarno found that most of his patients were goodists, people who are overly responsible perfectionists and want to be seen as good by others. These traits sound nice on the surface. Like, who doesn't want to be seen as, very responsible? But they often hide very deep wells of rage or unmet needs, injustice, or even years of self abandonment. And here's the paradox: you may not feel angry. I mean, I didn't feel angry, even though it was jujitsu class. I mean, at that time, I kind of did, but nothing else was going on in my life. You may feel anxious, exhausted, or physically worn down, but beneath that surface, your subconscious may be simmering. And when the brain senses that this anger could boil over or disrupt your own identity, it creates a distraction. And that distraction is that physical pain that we're talking about that feels safer than facing anger. Isn't that incredible? The pain feels safer than facing anger. So the physical symptom feels safer than attending to our emotional need. So, how can you heal? Here's where things get hopeful. Many patients in Sarno's practice and thousands more through his books reported significant improvement just from understanding the true cause of their pain. So first, they need to be open to the concept of TMS. When they're open to the concept of TMS and would like to entertain the further dive into this concept, that alone begins to loosen the brain's grip. And the process with his patients, and I think he said it was about 85% success rate. The process looked like education. He put his patients through 2 sessions of 2 hours each, where he did group sessions to tell them more about TMS and understand the mechanism, because knowledge is power. And another step was journaling. So the exploration of what they might be suppressing, think childhood wounds, anger at parents, resentment at the job, grief that hasn't been acknowledged, etc., etc. Somatic work, integrative practices that allow the body to feel and express, and putting that emotion in motion rather than suppress. This might be shaking of any sort, dancing, breath work, or somatic experiencing. And then affirming the beliefs, remind your nervous system that you are safe now. The pain is not a threat and you are allowed to feel. And lastly, in some cases, he did mention that when suppressed anger and rage has been in his patients' bodies for way too long, then psychotherapy work was needed. And he did refer them out to psychotherapists alongside with educating them about TMS. Something that I remembered he was quoted saying is the brain will only stop producing symptoms when it is convinced that the danger has passed. It's very similar to the fight or flight, right? The high cortisol, that fight or flight, needing to attack or be on alert, is another example of that, because we will not stop producing cortisol, for example, the stress hormone, unless our body and our nervous system feel at ease that there is no danger to our body or ourselves. So bigger picture, this really ties into what we talk about so often on this podcast. Healing isn't just physical or mental or spiritual. It's all of it. TMS really reminds us that true healing often requires us to descend into our depths, into the places where we've been silenced or hurt, or where we swallowed our truth. That is not weakness. That is soul work. This is cell work. And in integrative medicine, we look at the human being not as a machine with broken parts, but as a dynamic field of consciousness as a whole. And a being whose biology responds to energy and emotion and memory and meaning. So yes, Your back pain could be TMS. And more than that, your pain could be an invitation to listen, to feel, and to reclaim your voice and your peace. Something to think about. All right. So I highly recommend you check out Dr. Sarno's books that we mentioned in this episode, especially Healing Back Pain and the Mindbody Prescription. And if you're on your healing journey, whether it's physical, emotional, or spiritual, I want you to know that you're not alone. The new earth is not just something we build, but it's something we become. And one conscious breath, one act of honesty, one layer of healing at a time. Until next time, stay curious, stay grounded, and stay open. This is Noah, and you've been listening to Raising the New Earth. I'll see you soon. Bye.